Come in.
Good day, Ma'am Myra May Kabusaw.
Okay,
How are you?
I'm fine.
Okay, how is your feeling? Do you feel any discomfort for today?
No, I'm
Okay, great. So for today, um, I'm gonna help you to assess your eyes, nose, ears, and mouth. Okay, is it okay for you? Okay, by the way, guys, I'm Miss Alvina Mira from 1BSNT, Pamatasan ng Sodong Marikina, and me and my client will perform an assessment for eyes, nose, ears, and mouth. So, Ma'am Myra, just wait for a while and I'm gonna perform my hand hygiene and wear my gloves before we proceed or start for the procedure, okay?
okay.
Just wait me and I'll be back. Okay, I'm done washing my hand and putting the gloves on my hand in order to avoid any cross contamination or microorganism can grow in this area. So before we start, here are our equipment that we will going to need in this activity. First is our pen light and our tongue depressor, our card or paper card in order to cover our client eye in terms of visual test, and also my gloves. And last is our Snellen chart in order to test our client visual. So first, ma'am, um, how about your eyesight? Do you have a blurred eyesight or
No,
oh, so you have a clear vision?
yes.
Okay, great. So, in order to identify your vision or clarify what is your types of vision, we're gonna have a visual test using our Snellen chart. So, will you stand up and we're gonna do the position in 20 feet? 20 feet far for our Snellen chart. So will you please place it here in the side of the mirror, door. Okay, Ma'am Maramika Busao, and will you please cover your right eye with this card, and we're gonna use this Snellen chart. So will you please read the smallest letter you can read in this chart?
Um,
What is number? What is the smallest number you can read in this chart?
10.
Okay, number 10. So, okay, let's read it.
F, D, P, L, P, C, E, O.
Okay, great. So since you can read the number 10, also please read the number 10, number 11 with your left eye, right eye. Okay.
P, L, Z, O, L, C, T, P, D.
Okay, great. Okay, thank you. So, Ma'am Myra, I saw that you have a clear vision while you're reading this chart because I asked you lately that will you read the smaller letter you can read in this chart. So, first you read the number 10, which is the PDPLTCEO. Next is we turn in number 11, which is the smallest letter in this chart, which is PE, but you read it as L, Z, O, L, Z, F, but you read it as T and PD. So I think you don't have any problem on your eyesight or eye vision because you read it clearly, but you have some confusion on lettering and font of this church. So next we're going to use pen light to examine your eyes. If there's any problems or anything that we need to find out. So let's go. So, Ma'am Myra, we've done testing your eyesight using Snellen chart. Now I'm gonna use this pen light. So I'm gonna examine your eyes if there's any problems occur. So will you please look at the ceiling, and I'm gonna look at the ceiling and I'm gonna see the inside of your eyes. So I saw that you don't have any problem. It's moist, it's red or pinkish, but you don't have any redness on your eyeball. And your pupil is dark brown and it is properly round and have a proper roundness and size. So now we've done assessing your eyes. Next is we're gonna move to the next step of assessing, which is your ears. So I'm gonna palpate it and just tell me if you feel any pain, tenderness, or discomfort. So now I'm gonna palpate your ear. So do you feel any discomfort?
No.
Okay, and next, do you feel any tenderness?
No.
Pain?
No.
Okay, great. So next is, since we don't have tuning fork, I'm gonna use this wristwatch and I'm gonna place it in near on your ears and just tell me if you hear something from this clock. So let's start.
Yes, I hear the sound.
Okay. Okay, great. So you hear the sound of this wristwatch. So next is we're gonna move in this next part. Okay. Do you hear anything?
Yes.
What is it?
I hear the sounds of clock.
Okay, great. So you have a clear earring. So next is we've done on assessing your ear. I'm gonna use to whisper it to test your earring. So I'm gonna whisper you a word and just tell me what it is. So
Your t-shirt is blue.
okay, great. So next, your ear. Okay, what it is?
You are wearing necklace and your pants is white.
Okay, great. So you have a clear earring. So next, we're gonna assessing your nose. So I'm gonna palpate it, and also you will tell me if you feel any tenderness, pain, or discomfort. So will you want to do it for you, or you can do it for
I
yourself?
can do it.
Okay, so first, you gonna put it on this nostril and just palpate it down. Okay, do you feel pain, discomfort, and here breathing? Okay, so just palpate here. Do you feel pain,
No.
tenderness?
No.
Okay, here in the down part, do you feel pain?
No.
Okay, so next is, will you cover your nose with your finger and inhale, exhale? So do you feel hardness with breathing?
No.
Okay, next is the next part. Okay, inhale, exhale. So do you feel any?
No.
Okay, great. So let me see your inside of your nasal. Okay, I think it is clear and equal. So there is no any problem, even lump or any infection. So next is the last part of this assessment. we will going to use this tongue depressor, and I'm gonna assess your mouth. I'm gonna check the inside of your oral cavity and throat. Is it okay? Okay. First is I'm gonna assess your lip. Okay, your lip is fine. It is moist and it is pink. Okay, great. So I'm gonna use this tongue depressor, and I'm gonna use it to open your mouth or guide your mouth, and I'm gonna see, may I see your oral cavity? So okay, your teeth is wide, clear, and there is no any cavity. Your gum is fine. It is red or pink. Okay. Okay. Okay, I see your teeth is fine. So, will you show your tongue, and I'm gonna assess it. So now, your teeth is healthy and your tongue. So I forgot one thing. Can I see the under of your tongue? Will you show it? Okay. So you have a healthy tongue. Next is, may you show me your throat? I'm gonna. Okay. Say ah. Okay, great. So you have a healthy oral cavity. So now we've done assessing your eyes, ears, nose, and mouth. So thank you for your cooperation, but just wait me for a while. I'm gonna discharge all the equipment we've used, and I'm gonna discharge my gloves. Okay. So thank you for waiting. Now I'm gonna document all the things happened and this, and put a record of your assessment. Okay, your eyesight is fine. You have a clear vision. You have a clear earrings. You have a healthy oral cavity, and you don't have any problem on hardness of breathing. So okay, that's always fine. Okay, I saw that you are you are recovering in this past few weeks. So thank you for this day, and thank you for your cooperation. Just call me again if you have any concerns or problems in your health, and may you get well soon and you have a good day. Okay, thank you.